Believe it or not, it's already back to school season in some parts of the country. Looking at you, Arizona, which means it's time to think about fall vaccinations against viruses that circulate in colder weather and indoors in classrooms. For the first time, people at high risk for respiratory viruses, including the one called RSV, will be able to get protection. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF, and she joins us now. Dr. Gounder, thank you very much for being here. So who is most at risk for these seasonal viruses?
It's really a big picture, whether it's flu or RSV or COVID, it's really the same people. So it's infants, the elderly, pregnant women, people who are immunocompromised, people who have chronic lung, heart conditions, other chronic medical conditions, and people who live in nursing homes or other group settings.
Mm-hmm. And when it comes to the RSV vaccine in particular, who should get it?
So we have a couple new tools for RSV, also known as respiratory syncytial virus. So you have a vaccine for the elderly, for people 60 and up. For this one, we recommend you talk to your healthcare provider and see if they recommend it for you. There's also a shot that is not a vaccine. It's a monoclonal antibody called Beyfortus that was just approved and recommended by the FDA and CDC. This is to protect young infants who are very high risk for severe RSV. So if you have an infant who's 8 months or less, all infants are recommended. For infants 8 to 19 months. It really depends if they were born prematurely or have other risk factors.
Here's something we haven't talked about in a while. The C word, in this case, means COVID. I saw something on the news the other day that just said COVID is going back up, how much should we worry about that? And then we hear in the fall that there's a new booster coming out. Who should get the booster? Is it going up? You know, when I saw it in the news, I go, oh, no, not again.
Yeah, a few weeks ago, a friend of mine got COVID.
Really?
Yeah.
Had they had it before?
Had it before, and he said he's feeling okay.
Is he boosted? Is he boosted?
Yeah, it kind of shocked us.
Yeah.
We were like, wow.
We haven't talked about it in a while.
Well, we're certainly seeing it. In fact, I just had a patient in the hospital. Well, I'll get to that. So we're certainly seeing patients, and I saw a patient who was relatively young, who had COVID, who was in the hospital, not vaccinated. So just because you've been infected does not mean you have full protection. We're still seeing much higher rates of hospitalization and death, for that matter, among people who remain unvaccinated. Are we seeing an uptick? Well, it really depends on how you look at the numbers. We have seen a 10% increase in hospitalizations over the last few weeks, but 10% of a very small number is still a very small number.
And the booster that's in the fall,
so the booster,
should we get it?
Everyone 6 months and up can get the booster if they want to, but the groups, again, that most need it are the groups I mentioned earlier. So the elderly, pregnant women, people who have immunosuppression, chronic medical conditions, especially heart or lung disease, and people who live in nursing homes or other group settings.
But if you're not in that group, do you think you don't really have to get it? That's what I'm trying.
I think that's really up to you at that point. So some people feel more concerned. You know, are you the person who gets the flu shot every year? You're probably going to want to get that COVID shot. If if you've already been fully vaccinated, it's less important for that young, healthy group.
You mentioned the flu shot. Last year, flu season started a little bit early. When is the best time to get that flu shot?
We think flu season is going to be starting a bit early again this year, so maybe September.
Why do we think that?
Just because of what happened with social distancing and masking. It sort of reset the seasons for a whole bunch of things. It'll probably take a while before that settles back into normal patterns. But big picture, I would say September, October, and whenever you're able to get your flu shot is a good time to do it.
Okay.
Cool. Very good. Appreciate
Always good to have you at the table. Thank you, Dr. Gounder.